I'm Nancy Phillips, and I'm the coordinator of the Illinois Family Resource Center, and I'll tell you just a little bit more about that in a minute. We're looking at finding your protective factors. And I know some of you are probably going, don't know how that fits. It's a good CEU though. So I'm going to sit through this. I hope it's of some interest for you because it has lots of different uses. And taking a look at our risk and protective factors in our communities, in our families, is an important thing to do. And it kind of gets you thinking about what you can do and where you can go, where you can take your community and your family. To tell you just a little bit, the Family Resource Center is now 7 years old. They're in our 7th year. Started out as a federal grant looking at adolescents and getting families involved. And it was a federal grant, and the Department of Human Services and SUPER, the Division of SUPER, Substance Use Prevention and Recovery, have picked it up because they have such a belief that we have to support families, whether it's our 0 age ones up to grandparents and up, help support those families get through the chaos of substance use disorder, mental health issues. And we know now gambling is in such an increase and it has such an impact on the families. So let's just kind of take a look at some of those things as we go through today. The Resource Center, we do website postings. We've just redone the website and still have a few things to do, but we've really expanded it. And I think if you visit it, illinoisfamilyresources.org, you will find a lot of help, from posting videos that we recommend to books about everything, to events, things on gambling, things on grandparents raising grandchildren, as well as all the standard things that you would expect. We have a Facebook page, and obviously we have webinars because that's why we're here right now. And I can also do in-services, and they're very similar. The webinars, in-services, we always apply for CEUs for you. And we are licensed as a CEU provider for LCPC and LPC. So those are there for you to hook onto and use. The in-services oftentimes are more personalized to the organization that requests them. The topic may be the same as some of the webinars, but we can take that and fine tune it. You can do technical assistance, facilitation, again, the individualized in-service presentations, and do lots of conferences and exhibits. When there's conferences and exhibits, right now they're being done about half in person, half virtually. And March is a big month for that. So I am busy, busy, busy. And I also read a lot of research. So don't hesitate to take a look, to call, to get some help if you need it. But what I want to do now is introduce you to Karen Cook and really take a look at how we got to this place. Okay, Greg.
Good morning, everyone. I'm Karen Cook, of course. So I'm the ROS coordinator for the Our House. And if you don't know what ROS stands for, it's Recovery Oriented Systems of Care. Say that 5 times fast. We collaborate with one another to build and empower communities of recovery. As a ROS coordinator, I serve 5 different counties: Coles, Cumberland, Douglas, Effingham, and Shelby. So each regional ROSC works with key stakeholders to develop their local coalitions. Each coalition consists of recovery support services providers, treatment providers, families, faith-based organizations, other social service organizations, individuals in long-term recovery. We've got justice-involved individuals, probation, law enforcement, hospitals, schools, employers, and any concerned citizens. Our ROSCs have hosted Recovery Month rallies. We've done marches and celebrations, sponsored overdose awareness events. We conduct trainings like we're doing right now with Nancy. We hold monthly meetings to discuss issues of local concern. We identify and assist in providing recovery support resources for families and expand diversify the number of peer-based recovery support groups so that person seeking recovery can have more choices. And then I kind of wanted to share a video with you guys to get a better understanding of what ROSC is. So I'm going to share my screen.
This is an experiment, folks, so let's hope it goes.
Nancy, can you give me permission to share?
Well, let's see, because I quit sharing. There you go, you should be okay.
Okay, can everybody see that? Nancy, can you see that at least?
Yes.
Perfect.
Recovery from substance use disorder is a lifelong process, similar to other chronic conditions like diabetes or heart disease. In our society's relatively short history of treating substance use disorders, most of our efforts have been focused on short-term treatments provided at a point of crisis. Over the long term, effectively treating substance use disorders requires a range of personalized supports that work together to foster healthy growth and a meaningful life. This is known as a recovery-oriented system of care. For recovery to fully take root, all aspects of a person's life must be addressed. A recovery-oriented system of care encompasses the entire network of services and supports that help individuals improve health and sustain wellness. The focus of care expands beyond clinically directed models to engage the larger ecosystem of support that is community-based, person-centered, and builds on the strength and resilience of individuals, families, and communities. Recovery-oriented systems of care build partnerships and networks that increase recovery capital. This inspires positive outcomes by promoting prevention, early intervention, harm reduction, treatment, and recovery support across a person's entire life. This system recognizes that each individual is worthy of culturally relevant, comprehensive, coordinated care for their unique situation. Resources in the community are easily accessed and leveraged toward achieving each individual's goals. The central focus of a recovery-oriented system of care is to create a vibrant ecosystem of supports and resources to effectively address the full range of substance use challenges within communities, placing the person receiving support at the center of the process. This transformation of thought, policy, and practice emphasizes the hope and reality of a fruitful, long-term recovery. For more information on the benefits of a recovery-oriented system of care, visit the Peer Recovery Center of Excellence.
Okay, so that was a little bit more about ROSC and kind of what our mission is in our local communities. So I'm super excited to be here with you guys this morning, and I will let Nancy continue with her PowerPoint.
Okay. Sharing this with ROSC, the Central Illinois ROSC, is really great. ROSC has blossomed all across the state. They've now started their 4th cohort. I'm not sure how many there are now, but it goes from the top of the state to the bottom of the state with a lot of ROSC councils working hard at creating healthier communities. And this seemed like a good fit. Let's talk about risk and protective factors. But those of you that aren't necessarily tied to a ROSC, this is good information for you to have just taking a look at your program planning. It's important as I look at what information do I offer around families and helping through that. So keep in mind the idea of a recovery-oriented environment for the people in our communities, not only with substance use disorder, but with mental health and gambling. That all ties together. We know co-occurring it's out there, and that's what we're dealing with in these days. I've been in this field over 40 years, and I've seen a lot, I've experienced a lot. I have 4 generations of substance use disorder in my family. Thank goodness, pretty much most of it except for one, they've all been in long-term recovery. And so there's a lot us that need to think about how we address the risk and protective factors that are out there. So let's just do some exploring. One of the things that I have and wish for you is that you kind of understand some of the current issues impacting families and communities, or at least think about that. Think about your family, your environment as we go through this information. We'll talk about some of the research-based family and community risk and protective factors, and I'll give you a little piece of history of that as we go through this, and hopefully explore some strategies to support recovery journey environments. And recovery journey is not only for people that are actually experiencing substance use disorders, but it's the families too. I certainly would say that I'm on a recovery journey from my father's alcoholism, my husband's alcoholism, which is over 40 years sober. So recovery happens, folks. And a son with long-term recovery. So thinking about what we need to keep that going in all our communities is really important. I want to share with you a little bit of some definitions so we can identify some of what we're talking about, and you can start thinking about for yourself what you need to look at and impact. Substance Abuse and Mental Health Services Administration, which is federally funded. You know, it funds most of what the work we do, has identified risk and protective factors as one of their key things that they take a look at, along with reducing stigma. But I think this is really important as we look at the research and the information that's out there. Risk and protective factors can have an influence throughout a person's entire lifespan. And it's important that we keep that in mind, because the earlier research that really produced risk and protective factor models, social development models, communities that care model, which we will be talking some about, started mostly looking at how do we prevent these things with our youth. But we have learned over time that we have to be looking at the entire lifespan of people and the impact on that. And they've given some examples. For an example, risk factors such as poverty and family dysfunction can contribute to the development of mental or substance use disorders later in life. Some of those risk factors that happen early on have a large impact into how you move forward in your life and what kind of disorders, unhealthy behaviors, decision-making is there. Risk and protective factors within one factor. In other words, you pick one factor, such as the family, influences how you progress through other factors, either risk factors or protective factors. We can't function on just one. And the more we understand how risk and protective factors interact, the better prepared we'll be to develop appropriate interventions and strengthen our communities, which is really what we're all about. I think that it's important that we understand you can't take one risk factor and that's what you work on. We have to look at the big picture. Communities have to look at more than what they're seeing right in their face. They have to start looking behind those things to figure out where they're going. To give you some definitions, we can look at risk factors, excuse me, are characteristics at the biological, psychological, family, community, and cultural level that precede or are associated with a higher likelihood of negative lifestyle outcomes. And that's really what we're talking about, is lifestyle outcomes. How are you living your life? On the positive side, the negative side, how can the family and the community support what direction that goes? And as we look at the Ross councils, they are really focusing on what's happened before. We've brought in these people, we've talked to them, what do we need to be doing to create that healthy recovery environment that supports recovery and helps reduce relapse, reduces those risk levels. If you've got questions, pop them into chat and Karen can check on it. I can drop it down occasionally. This isn't the typical we're going to teach you about substance use disorder, but I think that these are important things to keep in mind. Protective factors, we need to take a look at those. I like working with these. They are events, conditions, characteristics of children, of families, of broader environments, meaning our communities, our society at large, that increase a person's chances of a healthy development and increase and support positive life outcomes, even if you've been exposed to significant risk factors and adversity. It helps move forward. This is where oftentimes people do a lot of talking about resilience and building resiliency. And as I was pulling back some of the information that I learned years ago about risk and protective factors and started looking at it, I thought, well, I'd like to throw in resiliency, but that's a whole workshop in and of itself. And that's to come. I really want to do that. I want to stop and look at how we build resiliency within individuals, within families, within communities. And that's a whole nother workshop. So keep your eyes open, and we will be working toward getting that out there probably early summer, and revisit some of this along with that. Again, protective factors are positive elements that have positive effects on our children and families and the community as a whole. Trying to see if we've had any comments. Okay. And this is kind of what I shared a while ago, targeting only one factor when addressing risk or protective factors isn't going to be real successful, because we don't exist in isolation. We are surrounded by all these things, and all of us are surrounded by risk factors and protective factors. And it's what that balance is that we need to be looking at. And if there's more risk factors in your environment, in your community, we need to be looking at how do we build and increase the protective factors for those same issues. Some examples: parents and caregivers who use substances or have mental health issues, where there's child abuse, where there's not appropriate supervision, that's a risk factor. But a protective factor for that same thing is a parent or a caregiver that supports their family, that supports their environment, that's a healthy role model. It's balancing that scale, and that's really what this is all about. Here's a couple of more examples. These were generated through SAMHSA. Risk factor, looking at neighborhood poverty and violence, neglected home care, social norms is a definite risk factor. And I'm going to show you for what types of things here in a minute. An example of protective factors is the availability of parenting programs, of faith-based resources, after-school activities, community support of recovery that speaks out in support of recovery. And if you look at society, some more examples, and I'm going to kind of talk through how some of these different topics happened here in a minute. Example of risk factors: norms and laws favorable to substance use and lack of economic opportunity. And I want to talk a little more about norms and laws favorable to substance use. Really almost translates into lack of the laws may be there, but they aren't addressed. They aren't recognized. They're ignored within a community, and it can go both ways. Protective factors: laws for that address hate crimes, that are policies that limit the availability of alcohol, that actually carry through the ways our laws are already written. So kind of giving you that background And some of you may be asleep by now, but wake up because we're going to talk about some things that we can do about that. I want to give you a little bit of background. Some of the first people to really spend a lot of time looking at risk and protective factors years ago were David Hawkins, Enrico Catalano out of this social work school from the University of Washington. And I've been in this field, like I said, over 40 years, and I was very fortunate to be able to work with them at one time when I worked at Prevention First. We did a lot of work with them when they were preparing for the drug-free years and working on communities that care, which addressed a lot of juvenile criminal behavior and that kind of thing. They did this work at a national level, and Prevention First was pulled into that. So I spent a lot of time out in Washington and got to interact with them and learn where they were coming from with these risk and protective factors. And I want to share some of that with you. And out of that, they've developed communities that care. And I'm going to give you some more information about that. It's been around for years, but it's been adapted in many countries. And it's still being looked at as a model. And I find that that's really encouraging. But to have heard some of the thoughts behind these as they emerged was quite a privilege for me. And looking at the risk factors, I need to get that chart here where I can put on my glasses and read it because I have some. I just want to share some of these. We're primarily going to look at the domain of community and family, and then some at the peer and individual. When we look at the community risk factors, low community attachment. If you have persons in your community and in your family that don't have an attachment to that community, that may be transient, moving in and out, that creates a lot of our community disorganization. And there isn't any foundation there to build your protective factors on. Community transitions and mobility, people go in and out. We know that, unfortunately, my observation at my age and living where I do is that a lot of our little tiny rural towns have become that. They've become that people move in and out. There's really not any employment there, but it's someplace that they can find a house to stay in. They're really not organized, and yet we have others that are just really supportive. But taking a look at that, laws and norms favorable to drug use. I didn't misspell these. This is Australia has implemented communities that care, and this is out of their materials because I really like the way they charted this and it was easy to use. The perceived availability of drugs, and oftentimes that perception is very real, but that is a risk factor, economic disadvantage. If we don't have jobs, if we don't have job training, vocational training for our young people coming up, opportunities to go to school, if that's what they want, those are risk factors. Those are the other thing that I think really stuck out with me 20 years later, 25 years later, in looking at community risk factors with them, was how important they said how important a neighborhood looks. That crime has a tendency to be up. Juvenile delinquency has a tendency to be up. Substance use disorder and mental health has a tendency to be more prevalent in neighborhoods where the homes are unkept, in neighborhoods where there are empty houses and the windows may be broken out, where there's garbage flying around in the yards, where there's fences that are broken down. And the thing that I saw as interesting is you take that same neighborhood and have people there that care about it. They may not have the money to turn it into this beautiful show place, but if they pick up the garbage, if the empty houses have boards put up so that the broken windows aren't there, so that there's a little bit of safety factor showing, if broken fences are fixed, if front porches are swept, that those things create a more positive approach and build positive risk factors, protective risk factors, because people have more pride in their neighborhood. They have more pride in their family, and their relationships improve. And that one piece has stuck with me all these years, because I thought, wow, I would never have thought about that. But I think that's true. Anytime you go through an area of town that may be more economically deprived, but yet it's cleaned up, it's picked up, and it's obvious people care about their environment, you feel good about it. And it builds those protective factors. It builds it in our children and in our people living in those areas.
Hey, Nancy, we have a great question in the chat.
Okay, throw it out.
It says, any examples of pro-social involvement in the community? And then they're also curious which geographic region you serve for in-services.
The whole state, folks. The whole state. I guess I really neglected that. I hate to go back in the middle of all this, but I want to come back to that question in just a minute. Illinois Family Resource Center is a statewide project. It's funded to provide services. And until the pandemic, I traveled all over the state. I did in-services from Aurora to, Cairo to Southern Illinois, and did a lot of technical assistance and those kinds of things. So I'm available through Zoom, or as we open up. This is a statewide program. So, and there's no barriers to who it is. It's for any community, any provider, any human service worker, any child welfare group that wants those services. Now, can we go back to the question that you threw out there? I don't know. Let me see if I can get it to drop down.
Yeah, it said, do you have any examples of pro-social involvement in the community?
Let me get there. And I think that we'll have some of that pop out. Yes, because we're going to go ahead and work more on that. And if I don't get you answered there, then be sure and email me. Can you put my email in the thing? I would appreciate that. In looking at protective factors for community, opportunities for pro-social involvement in the community, well, that's really, are you on boards of groups that are there? Are you participating in ROSC if you have it? There's a number of coalitions, especially that I'm aware of because I live in Central Illinois, being in Charleston, that I sit in on by Zoom, prevention coalitions, other community coalitions. There are community groups that are very similar to ROSC in other areas of Illinois that support their community. They work for their community. They do projects, they do fundraising, they take a look at the environment that they're in and go, what can we do to make this better? They may volunteer in some, through their church, through big brothers, big sisters. There's grandparents raising grandchildren. Let me tell you, I am one of those. So it's always helpful if I was in different circumstances, and I hear this from other grandparents raising grandchildren, if somebody could just give us a break, some respite care, pro-social involvement in your community. If you have young parents coming out of treatment services and they may or may not have a driver's license, and you've been able to identify that as part of a risk factor for people in your community as they enter a recovery journey, maybe you offer to take them on a ride if they have their children to see that they get to the doctor, to help them identify those things. Because if you're a parent and you're trying to take care of your child and you're in recovery, you're trying to get your, you may still be in outpatient services, you've got your self-help groups, whatever those may be, you need that support, that pro-social involvement. And it also helps you begin to feel good, like you're giving back to your community. So that's kind of where they're coming from, at least Hawkins and Catalano, when they look at their community things. Partially, how do you give back? How do you become engaged in your community? Okay, stop me, Karen, anything else pops up, please. Looking at family, poor family management and discipline, and whatever that family may be. It may be a caregiver. If you're an adult, that family management isn't going to be necessarily discipline, but it's going to be, what are the family guidelines? What are the family rules you live by? Is it full of family conflict? The more family conflict we know, the more trauma can be generated depending on how severe that conflict is. If there's actual violence, we know that domestic violence has gone up during the pandemic over the last couple of years. We know that especially youth suicide rates have jumped. So we are looking at a lot of these things that have escalated during the pandemic that we need to be building protective factors for now and start to turn around. And we're seeing that. We're taking a look in general and recognizing that there are mental health issues, especially among our young people, that we need to be looking at. But if you look at that family, if they don't know how to make that change, then the community can help step in. But poor family management and discipline, family conflict, a family history of antisocial behavior. We know that with substance use, it's often generational. Even with mental health issues, it can be generational. The rate of young people that have grown up in a family where there is a gambling disorder and them becoming involved in that same behavior, the research is coming out. The more we see of that, that they are at a higher level of risk. So family attitudes towards problem behavior is important too. Unfortunately, we all have probably seen what I would call inappropriate behavior. Let's just take the antisocial out of it. But inappropriate behavior, and the parent thinks it's funny. How is that child going to fit in? How is that young person, or even a partner, if you're laughing at their inappropriate behavior, going to be healthy? It all adds to that unhealthy lifestyle. The flip side of that is attachment and bonding to family. When families can build relationships, whatever that family looks like. And we have a lot of blended families now that have to look at different approaches to family bonding. And we have a huge increase in the number, and I'm going to bring some of that data up in a minute, grandparents raising grandchildren. So you have the child, you have the parents, you have the grandparents that have responsibility for them. How do you build protective factors so that there is bonding and attachment back to that family? You have to look at your community, what resources are out there, what people are available to do that. How can you start to make that turn around? I don't have magic answers because it has to happen within each environment, each community. We can look at some things that we know are general, but that's the thing that I think is wonderful about Ross, because it gives opportunities for people in recovery. If you have a Ross Council in your area that you're not participating in and you have lived experience, check it out. See if you can offer something that helps build that community and build that environment for recovery. Opportunities for pro-social involvement in the family. They have opportunities for faith-based experiences, for, in communities where there's not a lot of money or people are struggling with employment, having free movies in the summer out on the courthouse lawn, or, those kinds of concerts. I know here in our town, we have concerts in the park each week. It's those kinds of pro-social involvement. You can meet other people. You can become part of something that's positive without it costing you a lot. And taking a look at that. And that helps break down those cycles in families too. And before we get finished here, I'm going to offer you and share with you some information I have that we may be able to help some communities move forward in some of these family things. Recognition of pro-social involvement. Pat people on the back, say good job. It's pretty simple. If you have someone that's done a lot of work and impacted your community, recognize it. It never hurts to be patted on the back and say thank you to them. I'm not going to really go into any detail with the school. It's pretty, academic failure, low commitment to school. A lot of that links back in with the family. If parents are not committed to education, to the children going to school, to appropriate behavior when they're at school, that's a struggle. That's a problem. And that increases the dropout rates in an environment. I have known parents, unfortunately, right here in our own area, that it wasn't any big deal. The kid's 16, let them drop out. They can try for a GED. That's not the positive way. Well, that's my opinion. Let me put it this way. I don't want to be judgmental because there are times that does work, but it's that parental attitude that doesn't have expectations of achievement for their kids, because everybody can achieve some things and we need to catch them being good and say, hey, good job. Opportunity with the school, the more opportunities you have at school to be active in there, to be accepted, to be part of the group. That's what kids want. And that's what adults want, even if we choose not to admit it. Okay, let's look at the time here pretty quick. The peer and individual incorporates a lot of what I said about the community and family, looking at the risk factors, rebelliousness, early initiation of problem behavior. If it starts really early, hopefully parents step in and know that this is a problem and we start looking for solutions. The schools can help identify that. Our communities can help identify that. Impulsiveness, antisocial behavior. I go down this and I'm going over describing a lot of ADHD children and adults, because boy, I'm amazed at the number of adults that are now finding themselves diagnosed with attention deficit behavior disorder. And it's probably real valid. And if it wasn't addressed in their younger management, behavior management in their younger years, it's going to become a risk factor. Working with that in the earlier years is a protective factor. Interaction with friends involved in problem behavior. I have had to laugh when I was raising my kids. I said, just as soon you not go here or there or wherever with somebody, and they say, but we're the positive one. I said, they've heard this too much. You're the positive one. You're going to pull them with, and actually it does happen because I've seen it with my own families. And if somebody's rewarded or put on a pedestal or idolized for antisocial involvement, you need to be aware, because it's hard to turn some of those around. And especially when children's the time to start to work with that. By the time adults get there, oftentimes this is already their substance use disorder behavior. You're seeing a lot of that over there. And that recovery journey is tough, folks, but we need as communities to say, come on, let's do this and make our environment healthy. If you're an individual, if you have social skills, you've learned how to have social skills. I think everybody ought to be taught that in school, but it doesn't happen a lot. Belief in the moral order. Some of that goes back to our need for spirituality or faith, whatever that may be. Believing you're part of something larger than yourself in a positive way. It doesn't even have to tie into a formal faith. Emotional control, learning how to do that, and then interaction with peers that have positive behaviors, even as adults. I mean, when we talk about a recovery journey, we're not saying go hang out with your drug dealer again. We're saying look to the people that you know you can make this journey forward in a positive way. And in our environments, we can offer that through our communities and through looking at what the needs are in our communities. So that's kind of an overview of what Hawkins and Catalano came out with several years ago. Nobody has gone around and said these aren't accurate. but they've been updated. This is from some of David Hawkins' stuff that he's done, and I just thought I would take a look again at these, looking at risk factors of family. You can see all the things that they've been able to identify through their research that are connected with family issues, family history of problem behavior, substance use, delinquency, teen pregnancy, school dropout, violence, depression, and anxiety. Families have a huge influence. So as we look at helping our families come out of the chaos, if you live with someone with a substance use disorder or mental health disorder, you're going to be strengthening families through this, because when you have family members that are into any of this, your life gets pretty crazy. It gets pretty confusing and chaotic. And I do several workshops around that. How do you help families move past the chaos? What is important for them to have? And I am one of those people, so I've been there, still am. And so how do you manage that? But this is really looking at, I just kind of wanted to show you that their research went beyond just substance abuse and use as it goes. And here's the community. Again, looking at the issues that seem to be most impacted by these different things that you see in a community. Below, neighborhood attachment and community disorganization is really what I was talking about earlier that had stuck with me all these years. I think that as we look at the whole issue around the Second Amendment, the availability of firearms, people are on one side or the other, and I'm not going to say where I am, but I think that looking at how that's addressed within your community is important, because we've seen more and more young people experience some real negatives around that. Then the individual and peer, looking through that. I'm not going to go through these really. I will send out the PowerPoint when I send out the certificates. And you can take a look at this a little closer if you want to. But this is all stuff. I pulled these and a few other slides from a PowerPoint that David Hawkins did not too many years ago and posted. So I'm sure he has no problem with that. I want to throw out the information that we can't leave grandparents. It's not just because I am one raising a grandchild, but it's because there has been an increase. When I did this kind of presentation, and I did a whole one on grandparents raising grandchildren in December that we'll be offering again. But when I looked at the data, it just keeps going up because we have more and more families that the parents just aren't able to manage. And the children are being either legally through guardianship placed with grandparents, or they're just being handed over because grandparents take on that role. And by saying grandparents, it's usually grandparents, but it may be some other family member. And this is some of the newest information around Illinois. So we've got over 200,000 children under the age of 18 living in reported grandparent households. And over 100,000 of those are responsible for their grandchildren. Over 40,000 of the grandparents have been responsible for their grandchildren for 5 years or more. And then we have just a little over 60,000 of the grandparents have been responsible for their grandchildren 4 years or less. And the thing that's kind of scary, and if you talk to most people that work in child welfare, they say there are a lot of them that we aren't even getting counted. And at one point it was said that for every child that's known, legally placed in guardianship or as foster care or placed through the system, or is known in an accountable way, there's probably at least 4 to 6 others that are in that same situation, and we don't even know. And most of it is due to substance use disorder in the parents or mental health issues. So don't leave them out of your communities coming together. Don't leave them out of the process of saying, what do we need in our communities? What's going on? And in looking at that, I want to give you some ideas of how to get started. I know if you're on the Ross Council that you have samples of needs assessments and stuff, and we're going to run out of time here because I like to talk. I want to give you a couple of examples of ways that you can come together in your community. This is creating communities that care. This is one of their procedures of doing that, some of the newer things that they've had. Doing a community readiness assessment and identify key individual stakeholders and organizations. And when you're looking at substance use disorders and mental health, bring in those people that have experienced it. Bring in those family members, bring in those grandparents, bring in those neighbors. Find out what's going on. Consider them important. It's not just your people with all kinds of initials after the name, unless you also put the other. I oftentimes put PLE, person of lived experience, as an initial after my name, because it doesn't matter what degrees I have or certifications. I'm the person that's lived it, and that's what's important for me to offer to you. Get organized. Train your key leaders. If you have boards out there that people are participating in, or community coalitions, train them on what it is you're looking for. And if it's looking for recovery-oriented systems of care that support recovery, teach them. What are the issues that are out there? Share that with them. Share the stories. Next step is collect risk and protective factor and outcome data that you want. What are you going to address? You can even do this within your organizations, just to plan an event that you need around that's going to build protective factors for your community. Collect information on community resources. Construct some kind of community profile if you can on what data you've gathered. And if you're on a Ross committee, you've done some of that. Define what outcomes you want and then prioritize, because you can't fix everything. And we know that you can't address all the risk and protective factors, but think of them more as a group. You can't take just one either, because they all impact each other. Define your outcome, prioritize factors to be targeted. Look at effective interventions. Evidence-based programming might be part of it. When we first started this, we got evidence-based curriculum and did some piloting to reduce risk factors with adolescents and their families and increase protective factors. Develop an evaluation plan. Form task forces or groups if you need to. Identify and train people about what it is you're addressing. People need to know what substance use disorder is, if that's what you're trying to help create a healthy environment around. Evaluate those processes and adjust your programming. Pretty simple and pretty fast, but that information is out there, and that's what I want you to know, is that information is out there. Okay, in 5 minutes, I want to talk about this, the 2020 Strengthening Families. They have done some very similar work looking at our communities, and they have a little different model, but it's not that different from Hawkins and Catalano, because the risk and protective factors have not changed. We may have added some, and how we build those protective factors may have changed some, but they're still out there. No matter how much research I go over, it's still pretty much the same basic stuff that I was trained in years ago. In looking at their summary, they described what they saw as community conditions and factors that we need to really look at and helps communities flourish. Reasonable access to essential needs. If you are coming out of treatment and need an environment that's healthy for you, you need to have access to your essential needs. Your family does. While you were gone in treatment, while you were out using, they needed this. They need a job. You need a job. You need food. You need health care. You need a place to live. Those are all things that make your communities flourish. And if there are ways for that to happen, that's why I love Habitat for Humanity, or the Habitat process, because it helps communities flourish. Reasonable access to essential needs, social support and connection. Again, we go back to what's out there. Your free concerts in the park, your movies, being able to come together for different events, celebrating things around your community. We could do a Christmas tree lighting festival, you know, a Hallmark movie. Looking at that social support and connection through your faith, through your self-help groups, the racial and social justice in your community. And we're seeing a lot of disorder around that in our country in the last couple of years. And we need to work, all of us need to work toward remedying that. A shift in the social contract to include shared community responsibility for our children and our families. We as a group, as a community, need to be there to support each other. Shared community responsibility, especially if we have people that are seeking help for treatment services and don't have a lot of resources. Where are we as a community? How can we support that in a positive way? And take a look at that. Any comments around any of this at this point? Okay. They define community level work as work aimed at creating positive change for the community as a whole, and that looks at policies. You know, what are your laws that are out there? Are they enforced? Are they not? If it's a 21-year drinking age, is that enforced? If you can't buy cigarettes until you're a certain age, is that enforced? What are those policies? And are they carried out? Programs, what programs are out there? What can you do in your community? What programming? What kind of public messages are out there? And I say a lot of that goes back to what kind of advertising is out there. What's next to on the way to school? What are you seeing as advertising? I love it when I see the ROSC signs. I love it when I see you can get help for gambling. I like that because it is sending out positive messages of change. And then the community, what again, it comes back to Hawkins and Catalano did this, and so is the Strengthening Families. Concrete supports for families. Our families make up our communities, so how do we make them work together? In looking at the steps that they identified, very similar to what Hawkins and Catalano said, but I wanted to put it up there for you. Conduct key informant interviews with your stakeholders, your neighborhood groups, faith-based entities. Engage with parents and community members to understand their perspectives on what it takes to make the community thrive and what's missing, what needs to happen, so that whatever group you're working with, whatever direction you're going, you have input from the people that it's going to impact. Review previous information that's out there, or even literature that's out there addressing the community conditions and what's essential to promote your family's well-being, and elective strategies to those conditions. And there's some that have come up as I've done different webinars and trainings around different topics of families and et cetera. There's some good stuff out there that we can dig into. And if you're interested, get a hold of me and I'll try and reference some of that back to you. But we need to take a look at what works and what doesn't, and make it specific to our communities, looking at those risk factors. How do we build the resiliency and turn them into protective factors? And I promise you, we'll get the resiliency out there in more areas. They also say seek funding to support research activities. And I know a lot of the Ross councils are, you're going in different directions, looking for different kinds of funding to do things to change our environment into a more positive thing. Develop a policy agenda that identifies what policies and legislation you want to work toward that'll support your community in a positive way, and combine the results from the survey and other resources, of course, into your protective factors framework. Build that in. So there's several different models out there. And I'm going to offer you one that I want to share since we've got 5 minutes left. I have been very excited. We were going to do this 2 years ago when the pandemic hit and things just didn't work out. I'm taking a look at offering 2 to 4 teams from Illinois the opportunity to go through what we're going to really call it as a pilot, to receive the training on celebrating families. And it's conducted by the National Association for Children of Addiction, NACOA, that they are the experts on how do we address families and children with substance use disorder. And the people that form that are some of the top names of the research that's out there. But we are going to be doing this and offering this. And this is what I'm telling you. It's an opportunity. It's evidence-based. It's a 16-week curriculum that addresses, and this is the uniqueness of it, addresses the needs of children in families that have serious problems with substance use disorder. It was one of the first and just about the only true curriculum that addresses the fact that many of our parents are coming from families where they were children with substance use disorder in the family. And there's that whole chain from generation to generation that we know often happens with unhealthy behaviors. And it's evidence-based. It's been very popular. We used it here just on the adult section because it actually has curriculum from ages 0 through adult, meaning clear up through all the parents and grandparents to be involved in this, to help develop healthy lifestyles and substance-free environments. And I delivered the adult one for 2 years because I didn't want to give it to my staff when I was coordinating outpatient services. I love this curriculum. It's updated on a regular basis. It's based on research of the brain chemistry, skills, education, risk and resiliency, asset development. It places a real importance on the fact that community service and being part of community and recognizing your own individual spirituality and being part of something larger than yourself is important to families being healthy and for the parents to move through their recovery process. And it explores these 4 things. You can go online and look at it under Celebrating Families. But this is what you get. If you put together a team, and it has to have 4 or it has to have 5 individuals, they will not put teams into the training unless there's 5 people there in case you have the opportunity to deliver 0 through adults in your community. And that isn't going to happen very often, but they want to make sure that there's people to take the different roles and to share the responsibility within a community. It's 16 weeks long with fun curriculum to do, but very meaningful curriculum to do. There are videos, there are activities, there's lots of interaction, and you can do it all in one night, or you could break up the youth night into the other. But we are providing the curriculum, including the new 0 through 3 years supplement and all the videos that go with it. We're encouraging providers. Your teams can be made up, and what they have found across the United States as they've done it is they may have a drug court committee person, they may have a child welfare person, they have a substance use disorder provider, they have a faith-based person that's interested, but they've pulled together 5 people that are willing to work together through the training and then share the responsibility of delivering it in the community. And it's great. That curriculum is well over $500 worth of curriculum, but we are going to provide that to the people that attend this first. What it involves is 15 hours of virtual training that will be done in May. And we do have CEUs applied for. I'm working with IADAPTA, and since we are already approved for the professional licensure, we ought to be just fine with that. And then there is about a 3-hour pre-study that you do before you go into the virtual training. The virtual training, because we know people have other jobs and other lives, we've divided it up so that you don't get it all dumped on you at once. And it's 12 o'clock, so I'm going to kind of scoot through this. But in May, we'll do a Monday, Wednesday, Friday mornings. There'll be breakout rooms. You'll have a lot of interaction. And then the next week, Monday and Wednesday. so that you can still do your job. You can still have time in there to get things done that you need to do, but you'll come out of there with all those CEUs and the opportunity to deliver a curriculum that you'll just fall in love with and that will strengthen your community and the efforts. So it's 12 o'clock. I've done my ad with this, but if you're interested, please get a hold of me, because we can't do any more than 4 pilot groups, 4 or 5, that's 20 people, and everybody will get their own set of curriculum and handouts and everything. Big packets of handouts, plus the videos. So, anyone have any quick questions, comments? I'm just kind of flipping through this real quick to see. There will be a survey come up, and please fill it out. And if you have other things that you want to see us put out, email us. I think that Karen put my email out there. You can call me on this. I'm working from home most of the time right now, unless I'm out on the road by any chance. So I want you to take a look at your community and see what you can do to create that healthy environment for our families and for our people on that recovery journey. And if you're one of those family members in the chaos, take a step forward and start your own recovery journey. Okay, I'm kind of looking through these. Are great comments. I wish I could keep them all when it's over. I thank you, and I hope to see you again on another one before long. And if there's anything I can do, any services we can offer, please get a hold of me.
Greg, if you're still on here, please email Nancy or myself so we can get you more information about Celebrating Families.
Yeah, I just saw him saying good information. Yeah, it's a great curriculum, but you have to get those, they will not train unless those teams are together. So that's the only requirement we've had from them. And I understand their reasoning behind it. It's just in Illinois, we're kind of crazy and hurting for staff in some areas. That's why we divided up the training so that it didn't just pull you out of your work situation for long periods of time. So get a hold of me if you need me, and I'm going to sign off because it's time.
Nancy, if people are having trouble getting the survey.
Really? Well, I don't know what to do about that, because I put it in and it popped up when I tested it.
Okay. It should just automatically pop up, correct?
Yeah, as they leave, it should pop up.
Okay.
Yeah, I don't know what to do about that, because I entered it this weekend and tested it. Oh, and it'll be next week. I'll send out the certificates. I'll send out the PowerPoint if you want it. And it also has the information around Celebrating Families too. So thank you.
Thank you, everyone. Have a great weekend.
Bye.